It's with a deep sense of relief that I can say this morning to all South Africans that we have indeed exited the long-drawn third wave. When the president spoke to us last Thursday, he did mention this. Indeed, we have exited the third wave, which, as I've said, has been long-drawn. From our scientists in terms of modeling and monitoring indicated that on the 27th of September, we technically exited the third wave, which is really very welcome information. This third wave has lasted much longer than the previous two waves, over 100, close to 110 days, and indeed much longer than the previous waves. First wave, which was somewhere in the region of 80 days, and then the next one around 90 days. So this one, well over 100 days. The number of new infections have been consistently dropping in the last 3 weeks, with a 33% reduction in the last 7 days. There's been also a 19.3% decrease in hospitalization in the last 7 days, a very welcome news, which means that there's potentially a lot of relief for our hardworking health workers. Even more encouraging is the fact that we've also seen serious decrease in the reported deaths. In the last 7 days, we have seen a 51% reduction in the reported deaths, even though every one more death is just one too many. But obviously, we do appreciate when the death rate drops quite dramatically like this at 51%. The overall positivity rate has remained below 5% in the last 7 to 14 days, on an average over the last 7 days of 3% positivity rate. The average positivity rates have also reduced in all provinces. We still have some concerns with the Northern Cape and the Free State provinces, where the positivity rate has, even though it's gone down quite on a number of days, it has remained above 5%, and this includes the reported data of yesterday, where the Northern Cape and Free State were again at more than 5% of positivity. Also, the other important factor which tells us that indeed we are in better territory now is the fact that the reported reproductive rate of the virus is also below 1, standing at 0.67%, a very important indicator, which again says that we are entering stable territory. It is because of these encouraging declines in infections and stability of the pandemic that our President Ramaphosa, was able to make very groundbreaking announcements last week, reducing a lot of restrictions to level 1, with very liberal allowances, including more numbers of gatherings indoor at 750 and outdoor at 2,000, and also the curfew moving from 11 p.m. to midnight. We join the president in thanking all South Africans who have been resilient in observing the non-pharmaceutical interventions, such as wearing of masks, social distancing, avoiding crowded environments, hand washing, and also sanitizing. It is these measures which have brought us where we are today at level 1 of the adjusted restrictions. We wish to take this opportunity to appeal to all compatriots that please let us not lower our guard at this stage, because the reduced level of because of the reduced level of restrictions, we must not think that the pandemic is over. We're just being given a breathing space. It can be longer if we make sure that we behave properly and we avoid the risky behavior, and we observe the personal hygiene and safety measures. Let us always remember that while the numbers are down, the virus remains in our midst. While yesterday we reported only 989 new infections, which is far a lot of progress compared to where we were. huge improvement from the early July periods, where we are reporting in the region of 20,000 new infections on a daily basis. This virus, the killer virus, is still in our midst. There are still, just to remind us that indeed we are not yet out of the woods, let me just remind you that there are still over 5,000 people in hospital with COVID infection, of whom 885 are in the ICUs and 465 are on ventilators. So this is just a reminder to all of us that indeed this virus is still very strong, it's still there, notwithstanding the lowering of restrictions.